Good evening, my name is Gail Schlogel, and for this assignment, Unit 10 on substance abuse, I will be focusing on fentanyl. I've highlighted a few things that I found were very interesting about fentanyl, and hopefully you'll find them interesting too. Fentanyl was originally synthesized in 1959 by Paul Janssen of Janssen Pharmaceuticals. It's considered a Schedule II medication and was commonly prescribed or used in a hospital setting to treat severe pain, post-operative pain, patients with cancer, and patients who had severe chronic pain with a high opioid tolerance. What was great about fentanyl is that it worked quickly, it had a short half-life, and patients felt a state of euphoria and relaxation with pain control. It is structurally similar to Demerol, which was introduced prior to 1960, and it came in forms of IV, patches, lollipop, lozenge, and pill form. What's interesting to note about fentanyl is that it is a synthetic opioid and it's similar to morphine. However, it's 50 to 100 times more potent than morphine, and it's 50 times more potent than heroin. Fentanyl has a long-standing history of abuse. It was in the 70s used recreationally and was commonly available for purchase on street corners. It went under the names of like Apache, China White, Murder, TNT, Goodfella, and so on. Initially, it was assumed that it was just stolen from pharmacies or that healthcare workers were diverting the drug and then selling it on the street. However, very savvy drug dealers learned how to synthesize it and would cut or mix it with heroin or cocaine. What's interesting about fentanyl is 1 gram of fentanyl can be cut into about 7,000 doses of fentanyl for street sale. And these are typically about the size of a grain of salt or a coffee ground. They're very small. Drug dealers are very good at disguising fentanyl in other forms to resemble candy, like I've demonstrated here on this Pez candy on the left. And they're typically hidden with bright colors and bright shapes, so no one would really suspect that fentanyl was included. It didn't take a rocket science to figure this out. And drug dealers became very savvy with very little technical knowledge to perform this task. We all know that the United States has a huge opioid epidemic, heroin, methamphetamine, but right now fentanyl is considered the #1 epidemic within the United States. What I found interesting is the Drug Enforcement Agency would occasionally discover fentanyl labs in the 80s and 90s. And in 2000, the drug started appearing more on the street with more increased presence. The CDC reported that from 2005 to 2007, there was just over 1,000 deaths related to fentanyl in the United States. And what I found really odd and interesting is that most of them were concentrated in the state of Illinois and Michigan. Fentanyl, again, is often sought for its illicit purposes because it has such powerful pain relieving and relaxing effects, and it's mixed with heroin or cocaine to heighten their effects. When they're combined or when it is alone, it is extremely dangerous, it is deadly, and it has serious consequences and side effects. It's been very prevalent within the United States, and the Families Against Fentanyl reported that nearly 1 million people have died from drug overdoses since 1999. Specifically between the year 2000 and 2016, the rate of deaths from drug overdoses increased by 137%. This statistic is just mind-blowing to me. Fentanyl fatalities doubled in 30 states in just 2 years. We had 15 states in which they tripled, and we had 6 states that increased fivefold, being Alaska, Colorado, Louisiana, Mississippi, California, and Texas. These are all just fentanyl fatalities. This map here that I captured from Families Against Fentanyl kind of highlights the different states and those that doubled, tripled, and fivefold with the death of fentanyl fatalities. It's very, very interesting. You see them highlighted in brown, kind of orange and pink. On this slide, I've highlighted the 20 states with the highest rate of fentanyl deaths per capita. And as you can see, Florida, California, Ohio, New York, and Pennsylvania are in the top 5. I live in the state of Missouri, which ranks number 18. And I have been personally affected by a close personal friend who has died of a fentanyl overdose. So these statistics are very real to me. Fentanyl is now known as the #1 cause of death in Americans aged 18 to 45, according to the Families Against Fentanyl. And again, since 2015, have killed nearly 210,000 people. There are a lot of risk factors in our vulnerable populations that are associated with just about any substance abuse. I think they're pretty universal, but I'm going to specifically talk about some that are highlighted by Families Against Fentanyl as well as Vertava Health. Our demographics are always going to kind of place a person in a risk of addiction. What I found interesting was that ages 18 to 25 again are the highest risk. Caucasian males have more overdoses than females, living in a rural area, and I think some of these others are just kind of universal when we grow up in a personal environment where we see substance abuse, we have social influences, we have maybe history of mental health conditions or a personal history of addiction in our family. We'll see a higher incidence of substance abuse. Obviously, past or current substance abuse is going to put you at a higher increase of fentanyl overdoses. Here I've highlighted some short-term and long-term side effects of substance abuse. Short-term, we're going to see a lot of mood disorders, anxiety, paranoia, depression. We'll probably see irritability. We might see short-term some appetite changes, maybe hallucinations, some GI effects, whether that's nausea. I've saw vomiting and diarrhea listed as well. It's important to note that statistically, physical dependence sets in as little as 2 weeks with repeated use of fentanyl, and I found that a very interesting statistic. Long term, we'll see some adrenal gland issues, deregulation, lots of GI issues, constipation, bowel obstructions, mood disorders, again, depression, irritability, paranoia. We'll have some memory problems, both long-term and short-term, sleep disorders and breathing abnormalities. I commonly see dental problems, abscesses, and caries with a lot of substance abuse, but this was highlighted as well for fentanyl. The signs and symptoms of abuse upon assessment are pretty universal as well. We'll see an altered heart rate. It's usually bradycardia. We might have confusion, mood disorders, difficulty walking, muscle stiffness, And with all opioids, including fentanyl, we're going to see pinpoint pupils. What I want to highlight here before discussing treatment or what you will see in an overdose is to let you know that as a provider, healthcare worker, rescuer, EMS person, or just general public, is that the smallest dose of fentanyl where you come in contact with it via airborne or absorbed in your skin puts you at a high risk for a fentanyl side effect and death. So when we see fentanyl overdoses, we'll likely see cyanosis, and they're going to have cold, pale skin. They might be foaming at the mouth. Again, slowed breathing or no breathing at all, slurred speech, and stiff body. I've commonly seen these in patients that I've dealt with both in the ER and in EMS. What happens when you're using fentanyl over time, it slows down our natural production of dopamine. So our brain's going to trigger these cravings for opioids or fentanyl, eventually relying on that for our dopamine to hit our receptors instead of producing it naturally. You might see this causes a lack of motivation, anhedonia, short-term, long-term memory loss, trouble concentrating, mood disorders, and physical tremors. Fentanyl withdrawal symptoms are very similar to other opioids, and again, mood disorders, GI issues, hallucinating, blood pressure and heart rate are going to be erratic or very bradycardic. We'll see insomnia, restlessness, runny nose and sneezing, sweating. There might be some tremors or shaking. We'll see seizures in some patients, watering eyes, and yawning. The potential for overdose or use as suicide or even a weapon against another person is very high. Fentanyl is so deadly that an overdose is very likely with a very small dose. Again, the size of a grain of salt or maybe a coffee ground. So just using it once can cause this. Touching or inhaling fentanyl is deadly. It's airborne. It absorbs through your skin. Maybe you're giving CPR. It absorbs through your mucous membranes. That puts you at a high risk as well for an overdose or accidental death. Fentanyl overdoses necessitate the use of a Narcan, repeated uses of Narcan. I've personally had to administer 3 or 4 prior to getting a patient sent off through EMS. Because now Narcan's supposed to bind to the opioid receptor and block its effects, but fentanyl is stronger than any other opioid currently, and so it is going to require multiple doses before you might be able to get your patient back. Is it possible that a person can use it as a suicide or a weapon to harm others? Of course, again, it is something that you cannot smell or taste or really see upon using some sort of medication or illicit drug. I think it's really important to highlight the need of having a long-going standing care plan for patients with addiction. In fentanyl, of course, we're going to assess the patient's needs. We want to review all of their underlying medical conditions, including medications they may be taking or need to take. Inpatient medical detox would be ideal, but isn't always available given circumstances, financial circumstances, or even insurance or availability. The resources can be very limited. Residential care, sometimes we have access to that. I know in Missouri we do have a residential care program for those that are in active stages of addiction. We need to be sure to outline our goals of treatment and how we might be successful in helping those patients succeed in recovery and avoiding cravings. I think a referral to therapy is very important, both cognitive behavioral therapy and group therapy. And I want to say when we're assessing patients' needs, we also need to look at, labs, repeated labs. We want to make sure that we have close follow-up and that these patients are attending their referrals so that they can stay in active recovery. Another important part of a care plan, and for me as a provider, I intend to take additional MAT training. And if you're not familiar with MAT training, it provides comprehensive, tailored programs that provide medication, assisted treatments, and treatment plans to help modify behavioral and physical addictions. Medications might include methadone or Narcan, naltrexone. Therapy is going to help the patient curb their opioid cravings, allowing a patient to focus on their recovery. I think it's important to, if the patient is willing, to include their family and their friends and have a really good support system. Treatments that help manage their symptoms and their underlying emotional or physical addictions are very important during our care plans. These are going to be ongoing. We can expect patients to have relapses, but we should continue to assess the patient's needs and direct them to the proper place for care. In conclusion, I just want to highlight again that fentanyl, like any opioid, is extremely dangerous, but it is far deadlier than some of the other opioids that we might come in contact with. Again, statistically, the addiction and death rate have increased over the past decade, surpassing heroin, methamphetamines, cocaine, those type of illicit drugs. One use, one minor relapse in judgment can alter your life forever. I think that's an important teaching moment for any patient or family member, young adults who maybe are dabbling in other things, to highlight that it just takes once for them to overdose and die. It is important to recognize that opioids are always going to have an epidemic. Fentanyl is continuing to get more dangerous. Just today I heard of something on the news that referenced something called mud, which was Narcan resistant. And I believe they found this product in the state of Michigan or Wisconsin. Don't quote me on that, but I heard that in the news today. We should continue to support each other through MAT training, through peer counseling, through resources, offering support throughout our community and outreach programs in which we live and work. This is my references for you if you should find anything that you need. I hope that you found my presentation on fentanyl to be informative, and please leave me feedback. I'm curious to know what you think. Thank you so much for watching, and have a great night.